When I spoke with a prospective surgeon in my congregation and told him that I would have the privilege of sharing a few thoughts with you, he said, "Tell the press to ask the governor how the working poor are going to afford the $20,000 a year it's going to cost them to implement or to access her health care plan." Now, I just have to believe that there is sufficient brain power in that legislative body and in the mind of our newly elected governor to come together and work out a health care which reflects the basic American value of liberty and justice for all.
First of all, the need is, no question, the need is here. Nobody disagrees with that. The governor obviously doesn't disagree with that. The question is, how do we get there? I think to the extent that we fix little pieces of the problem and then celebrate as if we've actually solved the issue, I think it gets us in trouble. I think people should not be given even the slightest bit of false congratulations or self-congratulations for doing only part of the job. This needs to be done. It needs to be done now. It's not like the problem just existed starting today, and there's just no excuse for not doing it all today.
What I don't understand, if the doctors really want universal health care, which I believe they do, because then they could treat people the way they want to, and the people that live in the state, and all the states want it, and supposedly all of the politicians want it, basically what it boils down to is the insurance companies don't want it because they're the only ones that benefit from us not having universal health care. So I don't understand why the rest of us can't do something about these huge insurance companies that benefit so much from us not having health care.
Bills that would grant health care to everyone have been passed through many committees. However, the so-called single-payer bill was not passed through the Finance Committee. There are bills, however, that can be modified and amended to grant health care for everyone. We need real progress on this issue, and we need it now while there is a momentum for it. Let us make progress now so that we are not at the same place at the next legislative session. If presidential candidates such as Barack Obama can come up with comprehensive plans for the whole country, why can't this rich state take care of its own and be that shining example, that gold standard for the rest of this country?
If I were to say something to my legislators, if I were able to do something to give them a sense of what it's like, strip away their benefits, strip away the pension, because we don't have pensions anymore, strip away all the things that the government offers our legislators, strip it away for a year, just a year, and see how quickly they start taking action on this stuff. And I know Hartford is the insurance capital of, you know, whatever, but I don't care. That's not helping me today, and I'm not alone, and I know that. It's got to be done. The legislation needs to wake up. And not be afraid of losing whatever it is they're going to lose, whether it's contributions or votes or whatever the case may be, and start thinking in terms of what really needs to be done with the power they have. That's why they're given the power.
In actuality, if they're there to serve the public, then maybe look at the public.